Good morning. Thank you for joining us. My name is Chris Cable. I'm a Senior Program Officer at Northwest Health Foundation, and we're here today to discuss our grant funding opportunity we have open right now in our Healthy Eating Active Living program on community engagement grants. I'm going to give a brief overview of the grant program, and then we're going to open it to questions later on, and I'm hoping we can spend most of our time on questions. So, the Northwest Health Foundation has been interested in improving opportunities for healthy eating and active living for a number of years. The slides you see in front of you that are not going to be news for most of you. It's a These are from Behavioral Risk Factor Surveillance System, or BRFIS, the CDC's main surveillance tool. And again, it just illustrates in a very graphic form the dramatic increase in obesity prevalence we've seen over the last 20 years. And of course, this prevalence leads to a whole host of downstream health problems, including heart disease, diabetes, some forms of cancer. And we have a really strong interest in helping communities get ahead of this curve and hopefully reduce these trends. The rising prevalence of obesity has a tremendous impact in Oregon, and I need to recognize. I know we have a number of folks from Southwest Washington on the phone as well, and of course, Washington has not been immune to these challenges either. Quite frankly, the rise in obesity prevalence really has the potential to overwhelm not only our medical care system, but also our economic vitality as a region and as a nation. Uh, the increase has been seen not only in adults but also in youth, and probably most of interest to the foundation. The rising obesity prevalence has also played a major role in driving health disparities, particularly among Latinos, Native Americans, and African Americans. And we want to provide more opportunities for these communities to have a greater say in the opportunities for health that are distributed in these communities. So, what are some of the underlying factors that have really driven this increase in prevalence? Well, there are many, and we would need probably a multi day conference to fully examine them all. But in terms of the policies that can be really affected at the local level, one of them is the way communities are designed. Whether or not we have the opportunity to walk or bike to common destinations, whether or not our children have the opportunity to walk to school if they so choose, whether or not we have safe access to local parks. These are all factors that improve opportunities for daily physical activity, and a lot of them can be affected at the local level. And what it takes is our engaged local stakeholders and really sustained community advocacy to make it happen. Similarly, the food options that are available at the local level really affect health behaviors. Um, there's research that demonstrates that what types of food that are available at the local level does influence eating behaviors. Those who live in neighborhoods that with a very rich nutritional landscape tend to eat healthier than those who are immersed in neighborhoods where the only options available tend to be unhealthy. How do these underlying factors really play out in terms of obesity related health problems? Well, what you see here is a map that's actually generated by Kaiser Permanente. And what they did is they took the data from their electronic health record system and plotted it by census tract, specifically obesity prevalence. So what you see here, the darkest red census tracts are the ones with the highest obesity prevalence. The lightest colored ones are the census tracts with the lowest obesity prevalence. And while the data have some limitations, which I've articulated at the bottom of this slide, what it does show is when you overlay this map with factors such as access to healthy food or built environments that support daily physical activity, you begin to see a prevalence between how these opportunities for health at the neighborhood level actually play out in terms of health problems down the road, particularly related to obesity. And the distribution of these opportunities is not even. It does tend to skew along socioeconomic and racial and ethnic lines. And we really want to provide opportunities for communities to take greater control of how these resources are allocated and implemented. I know many of you on the phone are familiar with the County Health Rankings Report. It's a joint project between Robert Wood Johnson Foundation and University of Wisconsin. And one of the things that's really interesting about county health rankings is for the first time, it complements not only the health status uh, data that we've always had with regards to morbidity and mortality, but also to look at health factors, those underlying factors that really shape opportunities for health. Um, and so you see, the counties with the darkest colors are those with the lowest prevalence of positive health factors. And we're really hoping to see some proposals and ideas out of these counties with the least health supportive factors, to really jumpstart some community driven efforts to change this landscape. So why is the Northwest Health Foundation funding community engagement grants? Well, we've been actually supportive of community-driven efforts in our Healthy Eating, Active Living program for a number of years. And what we've seen is the proposals that tend to cross our door, that are most competitive, well, a lot of them come from Portland, Eugene, Corvallis, and these are places where there's already sort of a rich history of community engagement that has led to very well-defined plans and strategies. There's usually a very closely knit network of nonprofit and local government agencies that are working on these issues. Oftentimes, they have very receptive local policymakers who are willing to take their recommendations and use them. And what we realized is that if we're really to fulfill our mission, we needed to open the door wider to a wider range of communities, particularly in rural areas, particularly in tribal areas, and communities of color who have not yet had that same luxury of developing a well-defined set of objectives and strategies. So the community engagement grants are really intended to help more communities get to that point where they are going to be much more competitive down the road for larger, more funding opportunities to actually implement a well-defined set of strategies. The foundation intends to award up to 9 grants for up to $10,000. These grants can range for up to 12 months. Our grant-making region is the entire state of Oregon and 5 counties in Southwest Washington. We can accept proposals from nonprofit organizations or local tribal health departments. And if you are interested in pursuing any of this funding, the first step is to register your intent to apply. And that's very simple, only takes a couple minutes. You don't even have to define your project title, but we need you in the system prior to that July 6th deadline for the actual proposals. So if you are interested, please do register your intent to apply soon. And then the board will be making the final funding decisions in mid-September, and then we'll be sending out the grant agreements, and the earliest that funding could likely start would be mid-October. So we try to make this proposal process as easy and streamlined as possible. And with that in mind, we're only asking 5 questions. So we're not asking you to submit a line item budget. We're not asking you to uh, uh, submit a whole slew of letters of support from all your partners. Just 5 questions, and it roughly translates to about 3 pages written. First question is, why do you feel your community could benefit from an intentional discussion and planning process to improve opportunities for healthy eating and active living? So roughly, what sort of interest or momentum do you see in your community, and why do you think your community could benefit? Second question is, what methods do you plan to use to help develop a plan? And so that's really, it could include whatever methods you feel would be most appropriate and effective, meetings, focus groups, any sort of You could use it to pay partial staff time, facilitators, whatever you feel is most relevant and appropriate in your community. Third question, what partners do you plan to engage? And particularly if we're interested in if there are any representation in your community among uh, organizations or community members who have been most disproportionately affected by the lack of opportunities for healthy lifestyles. So this concludes part one of the presentation for the purposes of posting on our website, and we'll resume with part two in just a moment.